I'm just going to talk for a few minutes, and then we're going to have a really cool panel discussion with two other amazing women in the space. But I wanted to give you a little bit of background and a little bit of context. So I called my talk Reframing Women's Health and Aging because I think we really do have to start thinking about it differently. I think that understanding female bodies is basically the key to understanding how everyone can live healthier longer. So stick with me. I have a research lab at the Buck Institute, and the Buck is wholly focused on understanding how and why our bodies age. And the reason we want to do that is not just because aging is cool or, everyone's aging and we care about it. It's that aging is a public health pandemic. And age is actually the number one risk factor for every chronic disease in the modern world. Everything that's listed here, and more. And thanks to the work of hundreds of labs over the last few decades, we now know that biological aging is malleable, which means that if we can understand what's driving it, what the mechanisms are that are causing aging, then we can target all of these age-related diseases at the same time and reduce overall disease risk. So our goal at the Buck is to understand how to extend Healthspan. So if you think about your organ function over time, it's not exactly synchronous how your organs age, but what you can say is that if you're lucky enough to live to older ages, most of the decline happens in the last few decades, right? And so the goal truly is just to square off this curve, to extend what we call health span, or the number of years that you're healthy. Now, I'm not saying that we shouldn't consider rejuvenation and lifespan extension, all these things, but this is what we want to take care of first. And I'm a neuroscientist, so my lab focuses on trying to understand mind-body communication. And essentially what we think is that aging in the brain and changes in how the brain communicates with the rest of the body is what drives systemic aging. So if you think about your body like a busy city, your brain is the control center, and it's constantly sending messages back and forth to every organ in your body, integrating feedback and setting and then controlling your physiology. Now, most of that signaling is wired, right? So kind of like a fiber optic cable, nerves that travel between your brain and other organs. But your brain also has a Wi-Fi signaling system. So this is mediated by chemicals that are traveling between your brain and the rest of your body and basically controlling your physiology. And your brain's not ruling like a dictator. It's always thinking, it's always listening to this kind of chemical symphony that's happening. So I thought that as a woman, when we started to study this, I thought, there would be differences between females and males, but what we found was really quite dramatic. I'm not going to talk about my own work, though. I want to focus on female physiology. So obviously, we know that male and female bodies are different, right? You don't have to be a doctor or a scientist to know. You can see it with your eyes. But those differences, they extend from what you can see down to the cellular, down to the molecular level. And those differences between the sexes manifest with health and disease in different ways. And so there's lots of things that impact males and females the same, some things that impact both sexes but differently, like heart disease, and then some things that only impact one sex or the other, like prostate cancer or endometriosis. But I think about the female body kind of like a puzzle that we haven't solved yet. We understand much more about male physiology than we do about female physiology. I really did think that as a scientist and as a woman that I understood my body. I was completely wrong. So it turns out that women do live longer than men on average by a few years in every country where it's ever been measured. However, and I did not know this before I started working in the space, women have shorter health spans than males. They spend a significantly longer period of their lives in poor health, up to 25% longer. So if you're an American woman, you're going to spend about 12 and a half years at the end of your life suffering from one or more of those age-related diseases. And so at baseline, females have a shorter health span than males, which to me was shocking. Given that I'm a female, I was really concerned about this. And I think, why? Why is this? It's because we have an organ system that ages dramatically earlier than the other organs in our bodies. And those are the female reproductive organs. So it's important to point out that aging happens in the male reproductive system the same way it happens in female reproductive system. The key difference is that aging in females in their reproductive organs in males, is synced up with aging in the rest of the body. But with females, it really falls off this curve. And it really comes down to ovaries. So we call these the canary in the coal mine for human aging. And women's health span is compromised at baseline, specifically and directly, because ovaries age faster than the rest of the tissues in a female body. A woman's ovaries are considered geriatric by the medical community when she's in her late 20s, early 30s, and this has this profound impact on health span. I think it's really key to point out that ovaries are more than just egg factories. So they're important for more than just baby making. They're also endocrine organs, and they are communicating with almost every tissue in the female body. Much like the brain, they sit at the center of a really complex signaling network that is talking to almost every tissue in the body. And while we don't understand those individual conversations, because we genuinely don't know much about the female body, we have a lot of work to do. What we do know is what happens when you take them away. And what we can say is that they're promoting health. And ovaries are important for health at every age, not just for fertility and at menopause. In fact, 1 in 3 women have conditions that are caused by poor ovarian function. So when ovaries aren't working properly, it uncovers different health risks. And depending on who you are, how old you are, what your genetic risk factors are, and what your environmental exposures have been, it will uncover different health risks. So for a girl who's 10, it might mean that she has issues going through puberty, or if she's gone through puberty, she might have irregular menstrual cycles. For a woman in her 20s, it would uncover risk for things like PCOS or POI or POF. For a woman in her 30s, we're much more familiar with the downstream consequences with respect to infertility and miscarriages and things like that. And during perimenopause, which is a period of time that can span over 10 years, when ovarian function starts to fluctuate, it doesn't just go down, it fluctuates. That can lead to all of the symptoms that we associate with perimenopause, which are at 142 and counting. And at and after menopause, when ovaries stop functioning the way they were before, this really dramatically increases health risks for things like cardiovascular disease, osteoporosis. I could go on and on. But the key thing to understand is that we don't know why and how ovaries age faster. And this is the key. This is what we need to understand, is what is it that's driving ovarian aging? Why is it so different between individuals? And if we could uncover that knowledge, it would give us insights not just into things that would impact women's health, but it would tell us something about aging in the rest of the body and aging in men as well. I would also point out, based on the last talk, that ovarian function is really, really tightly linked to metabolism and immune function throughout a woman's life. But again, we don't understand how that works. So I would just leave you with this idea, if you don't remember anything else, is that ovaries really are the architects of health in female bodies, and they are the pacemaker for aging in female bodies. And I beg you to stop calling them reproductive organs. So I've stopped calling, we started a center at Buck 7 years ago now, which was devoted entirely to understanding ovarian aging. And then we started a global consortium with the same goal, but with the goal of actually seeding grants to scientists all over the world so that they could study this problem. We built resources. You can go look at our website if you're more interested in learning more. But when we started back then, I called this field reproductive aging. And I actually want to change that because reproductive aging is really about fertility. And that's important. But what I'm talking about is something much bigger. We're talking about all of women's health. And so call them ovaries, call them fallopian tubes, call it the uterus, but do not call them reproductive organs because they do so much more than that. So the science behind ovarian aging is fascinating, but we are woefully behind. There's a lot of reasons for that, societal taboos, which I think we're largely breaking through in the last decade or so. But the physiology of the female sex has been really dramatically ignored in terms of research for the last 100 years. Until 1993, women weren't included in clinical studies in the US. It wasn't until 2016 that the NIH made a rule that grantees had to actually use both males and females in their studies. So that means that we've collected a lot of data in males and not so many in females. And, that rule is about to disappear. So we're actually moving backwards instead of forwards, which is horrifying. And I think we can't afford to lose any more time. You can't discover what you don't study. And we're not like years behind or decades behind. We are generations behind where we need to be in terms of understanding women's bodies. And this is important not just for us, but for everyone. I won't go through the details, but women's health is obviously also woefully underfunded. This is data from the National Institutes of Health last year, which is the largest biomedical research funding body in the world until recently. 10% of their budget went to all of women's health from conception through death. A rounding error went to study ovarian aging. In terms of research and development in biopharma, it's similarly depressing, and there's investment in women's health, but we can't seem to break past this 4% number. And this has profound impacts. Over the last 16 years, there were 623 new drugs approved in the US by the FDA. Of those, if you remove cancer drugs, about 20 of them were for female-specific conditions. That's, again, less than 4%. And the pipeline is empty because we haven't been funding the basic science to feed that pipeline. That's why we are where we are, why women are waking up to the idea that they should learn more about their bodies and then finding that there's actually not that much to know. We need to focus on this. Without putting more money towards research and towards the pipeline, we're never going to understand female bodies. Everyone's health depends on it. The cost of not knowing is really profound. The cost of exclusion is important for more than just adverse effects in women. There's a massive ripple effect here. When we miss sex differences, we're missing half the puzzle, right? We can't solve half a puzzle and expect to see the whole picture. There's critical ways that understanding female physiology would impact men. For example, during the COVID pandemic, right, males were more likely to get long COVID, suffer from much more severe COVID, and die from COVID. They died at twice the rate of women. Why? We don't know. But we do know that female immune systems are better at responding to vaccines and also better at dealing with viruses. So if we could have unlocked that knowledge, it would have given us a roadmap to therapeutics that would have helped those men. Understanding why female brain cells respond to stress differently would give us some insights into aging and neurodegeneration. I could go on and on. There's dozens of examples like this. But I think what's important to understand is that this is not just about women, it's about everybody on the planet. And there's a huge, compelling economic reason to do this. This is from the Women's Health Access Matters report, where they calculated that $350 million of investment in women's health research, which, is not very much money, let's be honest, should generate $14 billion for the economy. So that's a 40x return on investment, which I think is pretty good. I don't know very many markets that do that. And this isn't really, it's not just about equity, although I think that's an important piece of it. I think we normalize female suffering and pain, and this is something that we can no longer accept. There are 4 billion women worldwide, and they make up a large percentage of the people actually spending healthcare dollars. There's actually a great market here, not just for menopause, but at every stage of a woman's adult life. But if we were to get rid of ovarian aging, or at least mitigate the health risks that come from it, we would save, apparently, $1 trillion a year annually. This is how much added healthcare costs there are for dealing with all of the downstream effects of ovarian aging. So I would say when we solve the puzzle for women, we're solving the puzzle for everyone. And I'm just going to take 1 minute to say, when 6 months ago, I never thought I would stand in front of an audience and say that we are moving backwards, but we are. Over the last 7 years, the gains that we've made, the progress we've made is being eroded at an alarming pace, particularly in the US. I think we're at a critical turning point with respect to this research that I think could transform human health. This is a list of words that are banned by the US government that have been used to pull grant funding to basically politicize science. Science should not be political. It's based on data. I think when certain words, these are a few of the ones that are on this list. When words are I know. And I probably shouldn't be saying this, but I'm going to say it anyway. I think when research funding becomes a political weapon instead of a public good, we all suffer. And these aren't just setbacks for science, they're setbacks for health and medicine. And I don't think we can afford to lose any more time. And for those of you, because I'm here in Europe, I wanted to give you guys a sense for what the NIH does, because it is the largest biomedical research funding body in the world and the gold standard. This is a graphic of the budget from 2022, but it would look the same, just with different numbers for this year. In 2022, there were $32 billion put towards biomedical research funding by NIH. These are the next 5 largest funders of biomedical research in the world. And so when you add them up, it doesn't even begin to approach this. Pharma's not going to fill this gap. The reason that government has to invest in the early stages of research is because it's risky. And also because you don't know, you can't make a roadmap to make a discovery. Lots of the research that we do is so basic you would never connect it to something that actually happens from it. Scientists have to be able to follow their research wherever it leads. And I would also point out that, nearly 100% of every drug developed in the US is developed using NIH funding. So I tell people that, if they don't support the NIH, they should throw away all the drugs in their medicine cabinet. I'll stop there and just say I'm here in a way to ask for your help to broadcast this message, not just as a scientist and a woman, but as someone who believes that knowledge saves lives. I think we need to choose knowledge over everything else and invest in the research, because really what we fund dictates what we know. And women's health is human health. It's not just about babies and females.